Good morning, everyone. Today, our lecture is about in lab diagnostics, it's about hyperglycemia. Um, now, I think almost everyone knows that anyone who have persistent hyperglycemia in their body, in their blood, we call it as diabetes mellitus. Or, in other words, you can say that the diagnosis of diabetes mellitus is basically when there is persistent hyperglycemia. So, of course, when we are discussing hyperglycemia from lab diagnostic point of view or from interpreting any blood report point of view, um, we must know what are the different types of diabetes mellitus, what are the normal values, and when we say someone have diabetes mellitus or other different things, which I'm going to discuss in this lecture today. So, of course, you can say the diagnosis, the baseline is what? The diagnosis of diabetes mellitus and related hyperglycemic states. So, of course, like you guys know about diabetes mellitus, but maybe you guys don't know about like others uh, hyperglycemic states. So, we will talk about them also. So, it relies on accurate interpretation of blood glucose readings or levels. So whenever anyone have hyperglycemia or whenever we get any blood report, uh, simply we interpret them and we decide either the values are in normal limits or either there is something we call it as impaired fasting glucose, or there is one more thing which we call it as impaired um, glucose tolerance. And of course, one of the conditions which we all know is called as diabetes mellitus. And one of the thing which we call it as which occurs in pregnancy, we call it as gestational or gestational diabetes, gestational, gestational diabetes mellitus. So now these are all the things which we are going to cover in this lecture. And as I told you, like maybe many of you know what is uh, diabetes mellitus, but and what are the normal things. But like many of you maybe don't know what is impaired glucose tolerance or what is um, what you can say impaired fasting glucose and what is gestational diabetes mellitus, right? So now to understand, of course, all these things, uh, we must know what are the normal values of glucose in the blood, as well as we must know when we say someone have impaired glucose tolerance or someone have impaired fasting glucose. uh, I would again stress on the need uh, in this case that remember, most of the labs which we do is basically we do keeping in mind what is the clinical status of the patient. Of course, like yesterday we were discussing in the last lecture what is diabetes insipidus, and I told you that these are the people who present with polyuria and polydipsia. So now remember this thing. It could be a screening test or it could be someone with the symptoms of diabetes, which is like increased urination or polyuria, or increased thirst or polydipsia. So remember, like in most of the circumstances, the diabetes is suspected clinically, uh, and why they have the symptoms of polyuria or polydipsia or any other symptoms of diabetes mellitus is because um, they have hyperglycemia in their blood. So of course, like if you are doing this test on clinical suspicions, then you are going to interpret this test in according to what you know about the clinical status of the patient. But in many of the times, you can say, for example, you went for a health checkup and you did a blood test for your glucose level, and you found now that someone have increased level of blood sugar simply. So it could be incidental findings. And generally speaking, um, you can say, of course, like I will not go uh, in too much detail about what are the signs and symptoms for diabetes mellitus, because frankly speaking, just to talk about the diabetes mellitus in detail, maybe even 10 lectures each of 2 hours would not be enough, because diabetes is very common and it is highly studied thing. A lot of research is done. But of course, like you guys are still on your basic sciences, so for you guys, like remember polyuria, poly dipsia, as well as weight loss, fatigue, um, are the symptoms which are what you can say related to diabetes. And of course, like the patients can present with the complications uh, of diabetes mellitus. Of course, like in long-standing diabetes, what happens, like many of the patients, they can present with the complications of diabetes mellitus, like cataracts. Cataract is when the lens opacity uh, is increased, like simply blurring of vision, for example. Okay, so the people, they develop cataract in their eyes, or it could be, for example, a cardiovascular event, or what you can say, CNS event like stroke, or you can say nephropathy in which the kidneys are damaged, so on and so forth, of course. Or it could be like repeated infections, it could be uh, anything, of course. Like diabetes can present in multiple ways. Okay. Now, like I already talked about the various states of hyperglycemia, right? So we must know what are these. So starting from impaired fasting glucose, uh, basically how we diagnose. Of course, we are going to talk it in a while, but before talking about that, impaired fasting glucose is basically considered as a pre diabetic uh, state. What it means, like in these patients, their blood sugar levels during fasting, okay, they are not in the normal values, normal ranges, right? So remember, like whenever we check for hyperglycemia, we could do, like, it depends on what time you're collecting the blood sample. Or for example, if someone is fasting for hours, and then you are going to collect, like in simple words, like they say, like you have to do this test early in the morning without eating anything. So what it means, like they wanted to check your blood in the fasting state, right? So basically we check the blood sugar levels in the fasting state, and when they are above the normal values, we call it as impaired fasting glucose. And remember, like guys, uh, now they have the abnormal values, which are basically more than normal but less than what is considered as diabetes. So simply, uh, what you can say, um, these are the patients who have this condition, impaired fasting glucose. They are at risk of getting diabetes. Okay, so this is the important thing. Um, now, if we will talk about what you can say, impaired glucose tolerance in we do a test called as OGT, or simply you can say oral glucose test. So again, what we do is like we give the glucose to the patient orally, and how much we give basically 75 gram of glucose. Okay, the full name is OGTT, oral glucose tolerance test. So we give 75 milligram, or sorry, gram of glucose orally to them, and we check their blood sugar levels after 2 hours. Okay, and of course we will be talking about the value soon, but simply when they are not in normal range, rather you can say they are above normal but not in the range of making the diagnostic of diabetes mellitus, we call it as impaired glucose tolerance. And diabetes, of course, like when the levels come in the range of diabetes mellitus. Gestational diabetes mellitus, simply during the pregnancy, there are many hormonal changes in the body. And what happens? Some of the women who are not diabetic before pregnancy, but they develop high blood sugar levels during pregnancy. Okay, we call it as gestational diabetes mellitus. Now, guys, the important thing, like, once they are going to deliver the baby, their blood sugar levels go towards normal limits, or the normal range. But the importance of this thing is what, like, many of the females, um, um, when they have gestational diabetes mellitus, they are at increased risk of developing diabetes mellitus later in their life. Okay, so simply, you can say, when the woman had they develop gestational diabetes mellitus, later on after delivering, they have higher chances that they will develop diabetes mellitus. Now again, like talking more about this one, I would like to tell you one very important point, that universally, you can say, uh, uh, simply what you can say, of course we are discussing the diagnostic criteria right now of diabetes mellitus, right? So when I say diabetes mellitus, simply I'm not talking about IGF, which is impaired glucose, impaired fasting, IFG, sorry, impaired fasting glucose. I'm not talking about impaired fasting glucose. I am saying diabetes mellitus, which means practically this thing, right? So, like, this thing, many people, they later on they ask me this question, that our glucometer or our results, they are 176, and you said, the upper normal limit is 11. So remember, guys, uh, the values which are used to internationally, uh, it could be millimole per liter, okay, or it could be milligram per deciliter. Okay, so now, like, my lecture is basically based on this one, and simply, you can easily convert millimole per liter to the other values. It's not a big science. Okay, simply, roughly, if you will multiply this figure by 18, it is going to change the figure to milligram per deciliter. So anyone whose fasting blood glucose is 10, so multiply by 18, so it means like it will be around 180 milligram per deciliter. But again, like, it's not the accurate conversion I'm telling you. Simply, you can do what? You can convert it online. Okay, so But of course, like what I will be quoting right now will be in the millimole per liter, not in the milligram per deciliter, right? I will keep on saying the values in milligram per deciliter as well. So, and before discussing like more of the diagnostic criteria, uh, I must tell you about OGTT, oral glucose tolerance test. Okay, oral glucose uh, tolerance test. It is called as OGTT. Okay, so sorry, OGTT. So what is OGTT? Like it's basically we give 75 gram of glucose by mouth. Okay, like if the patient is fasting, we give them 75 gram of glucose by mouth, and we check their uh, plasma glucose levels. Okay, um, one reading before giving that oral glucose and one reading exactly after 2 hours of giving that glucose. Okay, so now the important thing again, which I wanted to talk about is basically uh, so you understand this thing. What you will give 70 gram, 5 gram of oral glucose is given, right? And what happens? One baseline uh, levels of glucose will be checked, and you can say, and one reading 2 hours after glucose, or you can say oral glucose, right? So this is the point here. Now, like when we will talk about the diagnostic criteria of diabetes mellitus, um, like I'm going towards when we say that the patient have diabetes mellitus. So the important thing to here, like to understand here is what is the criteria, okay? And remember, guys, the criteria is defined by WHO as well as American Diabetic Association, which we call it as ADA, okay? So diabetes mellitus can be diagnosed in variety uh, of ways, okay? Uh, or you can say uh, any one of the following is sufficient to make the diagnosis. Now, number one, uh, we say that a patient a patient with symptoms, like symptoms I already told you, right, with what we call it as random plasma glucose levels more than uh, 11.1 millimole per liter. Okay, so random plasma glucose levels. Now I am using the word random plasma glucose. I'm not saying fasting. Like randomly you check someone's glucose level and it comes more than 11.1 milligram per deciliter. Okay, so this is like one of the diagnostic criteria. Okay, so what you can say, 11.1 millimole per liter is basically equal to you can say 200 milligram per deciliter. Okay, so in that one, this is the value which we take. So of course I'm talking about in millimole per liter, and if you will have like a glucometer in your home, most probably like they are giving you the values in millimole per liter as well. Okay, now the second thing is when you can say um, a person, I know I'm not using the word patient because we don't know either they have diabetes or not. So a person without symptoms, okay? So any person who don't have any symptoms, so we need with two separate, okay? So separate. So in this one, a patient with symptoms need just one value of random plasma glucose levels more than 11.1. But if someone who don't have symptoms and they show uh, like two separate, like you took two samples, okay, uh, and on the two different occasions, okay, so two samples to two separate, you can say samples, uh, sorry, this one is okay, separate samples of more than 11.1 millimole per liter, right? So again, it's a diagnostic criteria. Now, like if the patient have this thing, he have diabetes. The patient have this thing, he have diabetes. Okay. Or, for example, number third criteria is like a patient with symptoms, okay, with symptoms, and his what you can say fasting plasma glucose levels. Okay. Now here, see, I was discussing, sorry, two separate samples of random plasma glucose levels, okay, and this one I'm talking about the fasting plasma glucose levels of more than 7.0 millimole per liter. Now see, 7.0 in the fasting state. Now guys, remember this thing, um, like 7 is basically, if you will convert it into milligram per deciliter, that is basically 126 milligram per deciliter. Okay, this one is 200 and this one is 126 milligram per deciliter. So this will be the diagnostic criteria of what you can say. And again, like the number 4 is simply the same thing which we do here. Like a person without symptoms, okay, with you can say two separate, um, you can say fasting plasma glucose levels of more than, again, 7.0 millimole per liter, right? So I hope you understand. Now, one thing, guys, like before telling you the fifth criteria, like of what you can say, um, diagnosing anyone with diabetes is simply we use one more thing which is called as uh, glycosylated hemoglobin. Okay, it is called as HB, sorry, HbA1c. Okay, now sorry, basically 1c is like this, 1c. Okay, so what is this HbA1c now? HbA1c is basically called as uh, glycosylated or glycated hemoglobin. So glycosylated or glycated hemoglobin. Basically, what you can say, this one is a form of hemoglobin, and this one is linked to the sugar. So simply, uh, what happens when the blood sugar level in the body is more, there will be more sugar which will be linked to this one. Okay, and when the blood sugar levels are low, so there will be less glucose which will be linked to this one. So now, as we know, we know that the life cycle of the rbcs is around 120 days. So simply, we check HbA1c level, and it can tell us how was the person blood glucose control was over the last 3 months. Okay, so simply, um, for example, if I will do my glucose levels now, and maybe it will come back as 7. Okay, and for example, if I will take 5, 6, 7 tablespoons or like of sugar, or I will drink Pepsi or cola or any other sweetened drink, my levels will be raised after 15 minutes. But if I will do my HbA1c levels now, and for example, they will come back as 5.5, and if I will eat a lot of sugar, I will do whatever, I will drink cola, whatever, if I will do my HbA1c level again, they will be the same. Okay, But if, for example, my blood sugar control is not good for the last 1 month, then of course HbA1c will be higher in my blood. So this one is taken that simply anyone whose what you can say glycosylated hemoglobin um, is you can say more than or is equal to more or no sorry uh, equals or more than 6.5%. Okay, so again, like if you want to measure this thing in millimole, so it will be 40 greater than or equal to 48 millimole per mole. Okay, so this thing is the important thing. So this is also one of the diagnostic criteria for diabetes mellitus. And one of the thing like which is the diagnostic criteria is simply a patient sorry, so this is the criteria number 5, you can say. And then of course the criteria number 6, so a plasma glucose level of 11.1 millimole per liter or more 2 hours after oral you can say oral glucose load. Okay, now like this OGTT we do in the borderline patients most of the time. Okay, so we don't do in all the patients. Now so the important thing is what, like if the patient is symptomatic, one samples, one levels are enough. But if the patient is asymptomatic, we have to perform at least 2 tests before labeling the patient with hyperglycemia or diabetes mellitus. So patients uh, now I will show you some table, okay, to make the things easy for you guys. Now you can see the guidelines uh, in this case to you can say diagnose the patients with diabetes mellitus. So see the guidelines for plasma glucose levels for diagnosis of impaired fasting glucose, impaired glucose tolerance, and diabetes mellitus. Okay, so whatever I was talking in the previous like slide, you will get this thing. First of all, okay, one thing which we can make sure easily for from this table is simply uh, the patients or the person who have normoglycemia. Now, what is normoglycemia? Of course, the glucose levels are normal. Like, or simply you can say the people who are not diabetic. Okay, so they have the plasma glucose level, fasting plasma glucose level of less than 6.1. So simply, if you are checking your fasting plasma glucose level and it is coming like 5.8, 5.7, 5.6, even 6, they are considered as normal. Or simply so this is like about fasting plasma glucose. Or simply, like you are normal, if you will conduct OGTT in you and you don't have diabetes, so of course your values will come back as um, less than 7.8 millimole per liter. So it will be like either 7.7 or less than that. Okay, guys. So simply, you can say normal glycemic state or glycemia, like when your plasma glucose level are normal. So simply, fasting plasma glucose, you can say less than 6.1 millimole per liter. Okay, and you can say oral glucose tolerance test, and after 2 hours you have done and the value will come back less than 7.8 millimole per liter, right? So one thing which is clear in this one, like these are the normal values, right? Now see um, what you can say. So simply less than 7.1 or less than 7.8 is considered as normal, and more than 7 fasting plasma glucose, or you can say more than 11.1 random plasma glucose level. Okay, now see, you can see that's very good, by the way. in the brackets they have written the milligram per deciliter, right? So of course, like, there is no need to convert over here. So but I will be talking about this one. So see, less than 6.1, and in this case, OGTT case, less than 7.8 is definitely a normal person, normal glycemia. And anyone in which the fasting plasma glucose level is coming more than 7, uh, um, or the oral glucose tolerance test is coming more than 11.1, it is definitely diabetes mellitus. So the problem lies over here, right? uh, and they are the things, uh, these are the pre-diabetic state. Okay. Now guys, see what's going on. And I already told you, why, what are these term means, like impaired fasting glucose and impaired glucose tolerance. Like, these are basically the glycemic state or the glycemic control that lie somewhere between the normal and the diabetes mellitus. Okay, the values, they are in the middle. So now, what you can say now, it's not like this that uh, they both are completely separate, but for example, it is possible that the patient have both impaired fasting plasma glucose and impaired oral glucose tolerance. Okay. Or the person may have isolated type as well. You can see over here, this one is the isolated one, in which you can see uh, isolated IFG. So in this one, see, their value are coming less than 7.8 in OGTT. So it means like it is coming back as normal. But here, what's going on is the values are abnormal between 6.1 to 6.9. So this one is definitely normal, and this one is definitely not normal and not diabetic, right? And you can see over here the pre-diabetic state, which we call it as impaired glucose tolerance. So again, uh, now it is impaired glucose tolerance only. So you can see when we are doing in this patient FPG values, and they are less than 6.1, or which is definitely normal. But here you can see the values are between 7.8 to 11.0, which is definitely not normal and definitely not diabetes mellitus, but we call it as isolated impaired glucose tolerances. Patient number third, you can see someone who have the abnormal value of fasting plasma glucose, as well as abnormal values of OGTT. So these two are definitely abnormal, but definitely not normal and not diabetic. So we call it as pre-diabetic state, and they have both impaired fasting glucose and impaired glucose tolerance. Whereas in this one, you will see their values are coming more than 7 if we are doing this test, or if we are doing oral glucose tolerance test. So the values will come back as more than 11.1. And this story, I told you what is glycosylated hemoglobin. So whenever the value is more than 6.5 or is equal to 6.5%, we call it as diabetes mellitus. Okay. So uh, that's like how we diagnose diabetes mellitus. Okay. So I hope you understand, and a very very important values, very very important concept, very very important thing to when to say the patient have diabetes, or when the patient have impaired fasting glucose and impaired glucose tolerance, or when the patient have isolated impaired glucose tolerance test, or isolated impaired fasting glucose, right? Like this one, the one which is glycosylated hemoglobin, you can see over here. Like, these are the patients, like when we like randomly check their glucose measurements. Okay. So of course, like when we randomly check, of course, it varies from day to day, you can say, activities. For example, uh, the person diet, the person lifestyle, and all this stuff, right? So of course, uh, if we want to check like the long term thing, we check this one, right? So now, uh, as I told you, the glucose is attached with hemoglobin A, and that's why it is called as HbA. Okay, so HbA1c. So now, simply, And HbA is the main type of hemoglobin, in the adults. So whenever like the blood glucose level is higher on average, there will be more this type will be present in the blood. And as we know, like the lifespan of the red blood cells is long. Okay, so uh, this one provide us the control over a long time. Basically, last 2 months you can say it show us. Okay, so now like that's why they use this thing. But a very important test thing which I want to mention about this test is what this is only reliable when there is normal hemoglobin present in the blood. Okay, so anyone who have any hemoglobin disorder in which the lifespan of the red blood cell is shortened, like hemolytic anemias, so of course like we cannot trust on this thing. Okay, so this is an important point to remember in this one. um, Other than that, guys, the important thing to discuss over here is um, what is left. Um, oh yes, gestational diabetes mellitus. Gestational, um, gestational diabetes mellitus. I told you, like during pregnancy, there are many hormonal changes going on, and this is the type of diabetes which occur during pregnancy. Okay, or you can say diabetes first uh, first noticed during pregnancy. Okay, like simply these women they are normal before. So the principle of to diagnose this one is basically exactly like this way. Okay, so when the woman have abnormal values like this one, we say that that this woman have uh, impaired glucose tolerance. And the values when it come back like in this one, we say like the patient is gestational diabetes. So most of the times, in developed world, they do like to the general population. What we say that we are going to conduct a sugar test. So you can say um, uh, we do it in mid of the pregnancy and as a screening purposes, or if the patient is having sign and symptoms, uh, we can do it anytime. And simply uh, you can say all women who get diagnosed uh, with GDM is gestational diabetes mellitus, should have a repeated uh, oral glucose tolerance test. Um, you can say 6 weeks after the delivery, just to see like either they are coming back to normal or not. Okay. Now, guys, what's the importance of gestational diabetes mellitus? This is also important thing to tell you guys. Whenever any woman have gestational diabetes mellitus, okay, so what happens is uh, you can say they may have some complications during pregnancy. For example, um, uh, gestational diabetes mellitus is not just the risk for the mother, rather to the baby as well. Uh, Basically, their babies become big, so they give birth to big babies. Okay, so one of the thing is this one, they are larger babies, so while delivery, there could be many problems with the delivery of the baby. There is increased chances of what you can say stillbirths. There is increased chances of hypoglycemia in these babies. There is increased chances of polycythemia in these babies. There is increased chances of hypocalcemia in these babies. There is increased chances of delayed birth or stillbirths. Okay, so and also like these women have increased chances of preeclampsia as well. So of course, like you don't know about preeclampsia, but like in very very simple words, I can tell you that these are the women um, who get high blood pressure with proteinuria. Okay, so this is the important thing. Okay, so this is how we check these things. Okay, in these mothers. Of course, like one of the thing is called as you can say hypoglycemia. Okay, hypoglycemia. Now, uh, to tell you what is hypoglycemia is simply uh, now different books, regarding hypoglycemia, because I have concerned different books. Uh, they give different values of hypoglycemia. Now, you can say, as you know, hyperglycemia is increased blood sugar levels. So hypoglycemia, uh, what you can say, it means like less blood sugar levels. So, okay, when the plasma uh, glucose um, levels is less than 3.5 millimole per liter, we consider this condition as hypoglycemia. And now, this is not a very hard and fast rule of 3.5. Why? Because I am using 3.5 because of a purpose over here. Because in diabetes, like you can say, in a patient of diabetes mellitus, I am talking about a diagnosed patient, you can say levels below 3.9 millimole per liter is considered as hypoglycemia. And also, you can say, um, yes, you can say otherwise healthy population, a level of less than 2.8 millimole per liter is considered as hypoglycemia. So 2.8 is basically exactly 50 milligram per deciliter. Okay, so the same. And in the newborns, of course, this value is different. Like in the newborn, a level below 2.2 millimole per liter, which is basically a level below 2.2 millimole per liter. So this is basically exactly 40 milligram per deciliter. You can say um, it's considered as hypoglycemia if there is no symptoms, right? If there are symptoms, like the values that are more. So simply, guys, like whenever someone have hypoglycemia, what can be the causes? So hypoglycemia, most commonly it occurs in what you can say in diabetic patient. And what kind of diabetic patient is basically the people who are using insulin or sulfonylureas simply. And especially what kind of patients they are using insulin is basically type 1 diabetes people. So now, most of the time you will find a history that someone who take insulin, but today, after taking insulin, they forget to take the lunch or dinner, or they went for exercise, or they have infection, stuff like this. So you can say like one of the very important causes imbalance uh, between uh, insulin and calorie intake. This is the most common one. Okay, or for example, someone who take take or you can say exogenous insulin, someone who gave the injection of insulin to him, right? So this thing, or it could be a side effect. I told you about sulfonylureas, side effect of hyperglycemic drugs. Okay, so also you can say anti-hyperglycemic drugs. Of course, uh, the drugs which decrease the level of glucose, right, like sulfonylurea. Or there could be a tumor called as insulinoma in the pancreas, which is secreting more and more insulin. Or it could be liver failure, uh, or it could be alcohol ingestion. Okay, so uh, now a very interesting thing, guys, I told you about this one. Uh, how we can differentiate, like either someone have taken insulin from outside, or it is insulin which is produced inside the body. uh, there is a, like in psychiatry, like you are going to study a condition called as Munchausen syndrome. Like these are the people who basically uh, give themselves injection of insulin, just to seek some medical attention. Okay, so and now the insulin which is manufactured in the body, basically it is manufactured from pro-insulin. Okay, and the pro-insulin is formed by pre-pro-insulin. So whenever the insulin is formed in the body, so it is like pre-pro-insulin, which is cleaved to form pro-insulin, which is cleaved, it will form insulin. So this cleavage process generates a waste chain of amino acids called as C-peptide. Okay, it is called as what? C-peptide. So if anyone who have hypoglycemia due to, for example, insulinoma, or simply the insulin is forming in the body, okay, so what happens, you will found in their body high levels of C-peptide, which means what? Like this is the insulin which is formed in the body, right? So there will be high levels of C-peptide. Okay, and someone, for example, who have taken exogenous insulin in the form of injection, like you will not find uh, any C-peptide in their blood. Okay, so like any patient who will come to the hospital and he's showing the signs and symptoms of hypoglycemia, and you're suspecting like it is not insulinoma, rather exogenous insulin, so we can measure C-peptide. Okay, so therefore you can say a hypoglycemic patient with raised levels of insulin in the blood, but normal or low levels of C-peptide is likely to have been given an insulin injection. Okay, and what are the signs and symptoms of hypoglycemia? Remember, whenever the patients they go into hypoglycemia, guys, um, the sympathetic nervous system started activating to protect the body, and there will be increase of glucagon, which is, you can say, the opposite hormone to insulin. So they present with shakiness, palpitations, sweating, um, and nausea, vomiting, and headache, things like this. Okay, so remember, like shakiness and sweaty with lightheadedness, these are the symptoms, and you can say signs of um, hypoglycemia. So thank you so much listening, guys, this lecture, and I will see you in the next lecture. Thank you.